Hi, everyone. This is Dr. Weaver, and I just wanted to go ahead and make this voiceover regarding nursing leadership and management. Um, I think I told you earlier that it appears that I fell a little behind. Just trying to still figure out the layout of the course. And so, what I plan to do for this particular presentation is to um, go to about maybe slide 16 because I want to cut it in half. That way I don't, you know, um, wear myself out trying to do this in 3 hours, um, which comprise of pretty much the class. It'll probably be a little faster. The good thing about these videos is that the ones that I create here is that they will be on a YouTube platform. And so if you guys know anything about how with YouTube, you can actually um, speed up the video because I tend not to talk too fast, and I do that deliberately because I'm big on communication, and I'm not here to just try to get out information very quickly. I want it to be meaningful. I want people to understand what I'm saying, and so I tend to kind of slow down the cadence a bit. So anyway, without further ado, let's go ahead and get started. Again, this is leadership, nursing leadership and management, chapter 17. This is very important. Um, Typically in the clinical setting, believe it or not, even though someone may have been in in the practice setting with an associate degree for a couple of years or so. They are actually looking to people like yourselves, those of you who have graduated from these baccalaureate programs. Um, Many of these courses they don't get, especially leadership and management. And so you guys are very fortunate to be getting a course in leadership and management. And of course, I mean, you want to be able to lead well, right? You want to be able to have the tools to do what it is needed to actually lead a team, if you will. So, and hopefully, with this presentation, which is really more or less likely touching it, because I believe you guys actually get a leadership course. I think it's you'll be taking a course with Dr. Furman, but this is kind of a kind of an introduction, if you will. So, at any rate, so this is our learning outcomes or course or um, our objectives for this discussion. So I will let you all take a look at that. All right, take a look at that. This is just a course overview here. So during nursing school, students are often concerned with developing clinical knowledge and skills and are less concerned with management and leadership skills. And that's true. I think I've mentioned that to you all in class. I mean, you guys you typically are more concerned about, pharmacology and med surge and these clinical related courses. And this is, again, one of those courses that you will find very um, uh, needful in order for you to do your job as a professional nurse. And again, that is, you guys may find yourselves in leadership positions sooner than you know. All right. Um, Now, immediately after graduation, the new nurse is placed in many situations that require leadership and management skills. Managing a group of assigned patients. Um, in other words, it may just be your own patients that you're managing, and you have a PCT or tech under you. So even that will require some leadership and management skills, if you will. You may serve on a task force or committee. Um, you may have to supervise, as I just said, assistive personnel and also LPNs. All right. LPNs are coming back in the hospital, or they have been for the last, I guess, what, a year or so. And so you may have to lead and manage that population, or addressing difficult situations such as instability and bullying, which we talked about today. Now, in addition to providing safe, evidence-based, high quality clinical care, the challenges for RNs today are to manage nursing units that are constantly admitting, discharging higher acuity patients, to motivate and coordinate a variety of diverse health professionals and assistive personnel, and to look for ways to improve the work environment in order to support healthier patients and happier staff. It just makes working so much easier. Now, regardless of the position or area the nurse is employed, the healthcare organization will expect the professional nurse to have leadership skills, to use good clinical judgment, to ensure all aspects of care are safe, are high quality, cost effective, of course, ethical, and also patient centered. All right. Also, to promote evidence-based practice. You know, you guys get as part of your education as well. And so they expect for you to use those skills in the clinical setting. Also, to lead quality improvement initiatives in the work environment. All right, because we're always trying to improve our processes or the way we do things, ensuring that it's evidence based, obviously. All right. You may also have to coordinate patient care activities for the interprofessional team. Um, you will be working on teams of physicians and respiratory therapists and dietary pharmacists and what have you. And so your job might be to coordinate. Also promote team morale, patient satisfaction, which we know is all tied to what, reimbursement, and a healthier work environment, right? And lastly, you may be called upon to support compliance with governmental regulations and accreditation standards like JACO or the Joint Commission. And so all of these grand expectations for you is something you really need to consider. And hence, a great reason why leadership and management is so important. We'll also be talking about the difference between leadership and management. And there's a difference. They're not synonymous terms. Again, we'll get into that shortly. Now, leadership occurs anytime a person attempts to influence the beliefs, opinions, or behaviors of a person or a group. Right? Leadership is a combination of intrinsic personality traits, learned leadership skills, and characteristics of the situation. Now, the function of a leader is to guide people, groups to accomplish common goals. So again, we're going to define the difference between leadership and management. So, for example, an effective nurse leader is able to inspire others on the healthcare team to make patient-centered care an important aspect of all care-related activities. Now, it is important to note that even though leaders may not have formal authority granted by an organization, they are still able to influence others. I mean, you may be kind of an unofficial leader. People may like the way you look. You know, they may like the fact that you're very smart, that you're very knowledgeable. Just I don't want to say naturally per se, but well, I mean, yeah, you might just be that. But there's certain characteristics, traits. There's something about you that people just want to follow, and you can influence folks like that. Kind of make me think about, for example, in our primary, secondary schools, you always have some of these people who, you know, the group kind of looks up to. They weren't made an official leader of the group, but it's just something about them. Maybe they got money, you know, whatever the case might be. Now, the job title, nurse manager, also does not make a leader. You will find on your units where you will be working, hopefully very shortly, um, that you have nurse managers. They are a manager, but it doesn't mean that they are a leader per se. All right. Now, today's complex healthcare environment requires that every nurse, regardless of his or her role or setting, provide leadership to advance excellence in nursing practice and also patient care. Right. So we just talked about what the traits of a leader. What does that mean? Right. And so, again, as I mentioned to you, leadership and management are not synonymous terms. They have quite different meanings. All right. Now, management, on the other hand, refers to activities involved in coordinating people, time, and supplies in order to achieve desired outcomes, and involves problem solving and decision-making processes. Now, managers maintain control of the day-to-day operations of a defined area, maybe the ER or med surg floor, um, but operations of a defined area of responsibility in order to achieve established goals and objectives. Managers also plan and organize what is to be done, who is to do it, how it is to be done. A manager has an appointed management position within the organization with responsibilities to perform administrative tasks such as planning, staffing, performing employee performance reviews, controlling use of supplies and time, and meeting budget and productivity goals. So you can see the difference as I've spoken about leadership, and as I now continue to speak about management. You see what that difference is. All right. There is when as far as a manager is concerned, there's a formal line of authority. See, this person was given this particular job, right? Of course, a nurse manager can be both. You can be a manager and you can also be a leader, which is preferable. All right. Anyway, so there's a formal line of authority and accountability to ensure that a safe and effective care is delivered in a manner that meets the organization's goals and standards. Now, leadership is the ability to influence others, whereas management is the coordination of resources. What are those resources? It can be time. Time is a resource. It can be people as well as supplies in order to achieve a certain outcome, of course. Now, people are led, whereas activities and things are managed. All right. So when people are led, we're talking about leadership. When we're talking about coordinating resources, of course, then activities and things are then managed. Now, leaders are able to motivate and inspire others. whereas managers have assigned responsibility for accomplishing the goals of an organization. Now, a good manager should always be a good leader. See, that's what we want. We want a good manager, someone who's able to coordinate resources, but we also want them to be good leaders. And I will be the first to tell you that that is not always the case. In fact, it seems to be, well, at least during my time as an active, a practicing nurse, um, didn't see it a whole lot. I mean, I think a lot of these people were just selected for the job because they were skilled for that particular unit. Say, for example, an ICU nurse who's very skilled, know what they're doing, and so they tend to place them in these management roles. But it doesn't mean that they're good leaders by any means, and they're probably not good managers. All right. Um, so leaders do motivate and inspire others. On the other hand, managers have assigned responsibility for accomplishing the goals of an organization. Now, a good manager should also be a good leader, as I mentioned, but this may not always be the case, as I said. A person with good management skills may not have leadership ability. And I run into that a lot. Similarly, a person with leadership abilities may not have good management skills. It's just the way it is. Now, leadership and management skills are complementary. You know, they complement, or they should complement one another. Both can be learned. That's the beauty of it. It can be learned if a person is willing, and it can be developed through experience, right, and a willingness to learn. And improving skills in one area will enhance abilities in the other. So hopefully you have a manager who is willing to learn how to be a good manager, to learn how to be a good leader. Hopefully this presentation will also help you guys with um, your assignment that is due Sunday. And I think I may have said that you can turn it in before Monday midnight as well. If you just need a little time listening to the voiceover, I'm fine with that. Won't ding you either. All right. Now, leadership and management require um, a power and authority to motivate people to act in a certain way. You know, you're influential, right? Authority is the legitimate right to direct others and is given to a person by the organization through an official position, such as a nurse manager or a director. All right. So, for example, a nurse manager has the authority to direct staff nurses to work a specific schedule. Now, power is the ability to motivate people to get things done with or without the legitimate right granted by the organization. All right. And so you can see that if you desire to become uh, it doesn't have to be a nurse manager, it can be a charge nurse or the assistant nurse manager. But if you desire to do so, I would say to you that you want to try to develop your leadership skills as well. Right. Well, both skills, leadership and management skills. Um, um, this is something that you should be open-minded to. All right. If you're going to create that environment that is conducive to, getting the job done. All right. Now, the primary source of power is as follows. Reward power comes from the ability to reward others for complying and may include rewards such as salary, desired assignments, and acknowledgement of accomplishments, right? Then you have coercive power, which is the opposite of reward power, and it's based on fear of punishment for failure to comply. All right. Sources of coercive power include withholding of pay increases. You know, you won't get a pay increase, undesired assignments, verbal and written warnings and termination. That's something that's an environment I would not want to work under. Very stressful. And the types of nurses who work in these environments, they won't stay very long. All right. Now, legitimate power is based on uh, an official position in the organization. Through this legitimate power, the manager has the right to influence staff members, and staff members have an obligation to accept that influence from that person. Now, referent power comes from followers' identification with the leader, how they identify with that leader. The admired and respected nurse is able to influence other nurses because of their desire to emulate or model this nurse, albeit unofficial nurse leader. Now, expert power is based on knowledge, skills, and information. For example, nurses who have expertise in areas such as physical assessment or technical skills, or who keep up with current information on important topics, will also gain respect from others. All right. In other words, you become pretty much a resource, a ready resource for those individuals. Now, information power is based on a person's possession of information that is needed by others. Right. Connection power is based on a person's relationship or affiliation with other people who are perceived as being powerful. Right. And these folks are just really easy to recognize if you're observant. You go to a unit, even as you guys go to these units as students, just stand back and be observant. You know who the power players are, so to speak, official and otherwise. Now, an individual may also have an informal power resulting from personal relationships. All right, being in the right place at the right time, or unique personal characteristics such as attractiveness. Remember, I said that earlier. We like the pretty people, right? Education, their education, their experience, their drive, and also their decisiveness. They don't kind of vacillate, back and forth, or that, that, they don't have that ambiguous kind of trait, but they're decisive. They know what needs to be done, how it is to be done, when it needs to be done, and so forth. Now, by understanding the authority of an assigned position and the sources of formal and informal power, the nurse will be better able to influence others to accomplish goals. So you guys may not even be placed in an official role, but um, pay attention to the fact that you may possess influence, the ability to influence people for good, for productivity, as opposed to that which is counterproductive, um, and what have you. So these are the different types of power. Now, early leadership theory centered on describing the qualities or traits of leaders, and has been commonly referred to as trait theory by Stockdale. Um, Now, leadership trait theory was based on the assumption that leaders were born with certain leadership characteristics. Right, traits found to be associated with leadership include intelligence, right, alertness, dependability, energy, their drive, their enthusiasm, their ambition, decisiveness, self confidence, cooperativeness, and technical mastery as well. These were some of the traits that we saw that we expected from a leader. Now, although trait theories have been important in identifying qualities that distinguish today's leaders, these theories have neglected the interaction between other elements of the leadership situation. Trait theories also have failed to recognize that leadership traits can be learned and developed through experience, as long as they are willing, right? Now, in a contemporary concept of leadership, Burns identified and defined transformational leadership. Burns contends that there are two types of leaders. You have the transactional leader, who is concerned with the day-to-day operations, but then you have the transformational leader, who is committed to organizational goals, has a vision, is able to empower others with that vision. And so you can see, just hearing about the two, which one you would prefer to be. And I would prefer the latter, of course. Now, the transformational leader is able to guide employees to feel pride in the work of the organization, and also to inspire them to actively engage to achieve the mission and goals of the organization. This is the type of leader that organizations should always strive to um, bring on board, if you will. Now, transformational leaders spend time teaching, they're coaching others, they seek differing perspectives when faced with problems to solve. And this is just a great trait to have, even if you're not a formal leader, to be able to just listen to others, because people do have great ideas, right? And I'm always open to great ideas. People have a variety of experiences and knowledge, education, if you will, and so they may be able to offer a much better solution than you. All right. They also have a passion for excellence, and seek new ways to improve the work environment as well. When you get a chance, take a look at box 17, 1, how it compares characteristics of what transformational and transactional leadership styles are. So take a look at that when you get an opportunity. Now, studies have reported that nurse leaders who demonstrate more transformational leadership characteristics, they're able to provide nurses what they need to positively impact the nursing work environment, and also provide quality care. And as we know, that is what it's all about in today's healthcare system. It's all about quality. All right. Now, there are three major types of skills and practices that are required for effective, leadership. There is technical skills. Uh, for the nurse, this type includes clinical expertise and nursing knowledge. You also have human skills, the ability and judgment to work with and also lead people in a compassionate and caring way, right? Not that kind of cold, incompassionate way of leading. Also, conceptual skills. And this is basically the ability to understand the complexities of the overall organization, not just your department, but the overall organization, and to recognize how and where one's own area of management fits into the overall organization. You have the overall organization like Baptist Hospital, and you might be managing an ICU, but you don't want to just be so focused on the ICU that you're managing. You want to know where your unit fits into that larger organization, if you will, a systems approach, in other words. Now, at the staff nurse level of management, a considerable amount of technical skill and clinical expertise is needed, because the nurse generally is involved in direct supervision of patient care and may be required to help train and mentor other nurses. They may become preceptors, and what have you. Now, as one advances from lower levels to higher levels in the organization, more conceptual skills and practices are going to be requisite, right? Also, take a look at box 17, 2. It provides examples of technical, human, and also conceptual practices required for nurse leaders. So let's take a look at management theory. We have a variety of types of leaders. We have the authoritarian, the democratic, laissez-faire. Um, um, those are the three main types of leaders. Now, behavioral theories emerged to explain aspects of management based on the behaviors of managers, leaders, as well as followers. Now, three prevalent management behavior styles were identified by Lewin and White, as well as Lippitt or Lewin et al. You have the again the authoritarian, the democratic, and also laissez-faire. Take a look at box 17.3. It presents characteristics of these management styles, which vary in the amount of control exhibited by the manager and the amount of involvement that the staff has in decision making. For example, authoritarian will that's where most of the power is, and the people have very little ability to influence change. Not well, can be beneficial in certain situations when something is an emergency, something has to be done now. Otherwise, I would prefer the shared governance style of leadership. Now, at one extreme, an autocratic manager will make all decisions. The staff has no input and use the authority of the position to accomplish goals. All right. Now, at the opposite extreme, you have your laissez-faire manager who provides little direction or guidance and will forego decision making. So they're placing the decision making perhaps in the hands of a committee of expert and skilled nurses. Now, democratic management is also often referred to as participative management because of its basic premise of encouraging staff members to participate in decision making. All right. Now, today's healthcare system requires the use of a democratic or participative management style that involves the staff in patient safety, to improve quality, patient-centered care, and also cost reduction. All right, as I've always told you all, staff are working at the point of care. All right, they are working where all the work is taking place, and so they have a much better handle on what is going on. And so when they make or form committees and they try to develop solutions, if you will, um, then you're likely to get solutions that are more congruent to the situation and solutions that are more comprehensive and they work better. Again, as I told you, compared to someone who's sitting in an ivory tower somewhere and is so far removed from what is going on at the point of care, it's just much better to have your staff and you have confidence in your staff to help make decisions. And of course, you as manager and leader would be the facilitator. All right. Now, staff directly involved in the challenges presented by patient care can suggest the most workable and practical solutions. And this is why it is better to create those committees because, again, the solutions are more practical, they're more workable, they're more congruent. Which is very important. Now, depending on the situation, the nurse leader may need to use different types of management styles, right? So you can't just get stuck on one, right? You should have an understanding of them all because you need to know in what given situation where a certain leadership style is appropriate. So one of the examples your book gives is the autocratic management might be appropriate in emergency situations, such as treating a patient with cardiac arrest, right? That requires some decisive, quick action and can't just be standing around talking about it and thinking about all sorts of solutions, if you will. Now, on the other hand, in structuring the weekend call schedule for a home care agency, a participative style of management would be more effective in this case. In other words, there's time to sit down and to devise a schedule in a situation like this. Doesn't require that authoritative style of leadership. Let's look at organizational theory. Now, just as leadership and management theories evolved to provide a framework for understanding leadership and management, organizational theory evolved to provide a framework for understanding complex organizations. All right. Now, a brief review of systems theory and chaos theory can provide you with insight into the value of using organizational theory to understand management processes within today's dynamic, complex healthcare environment. In other words, the situations that are going on within these organizations today, they're not linear. You know, you can't apply this step one, step two, step three process anymore. There's chaos, perhaps a little more organized chaos, but it is chaos. A leader today needs more of a systems approach in terms of leadership and how to pivot and adapt. When different situations are coming at you, and then you're having to be able to make those decisive decisions. And again, not like a linear step by step, right? It's just that's just not how that's not the reality of what what happens in the real life setting these days. It's much more complicated. All right. Now, the systems theory views the organizations as a set of interdependent parts that together form a whole. You know, you got a variety of different departments, X-ray and the ED and the ICU and so forth. They're different pieces, but they all work together for the common goal of the organization. Now, systems have been defined as interdependent, right? They depend on one another, interconnected, all connected, people whose initial conditions create a ripple effect across an organization. In other words, if something happens in the ED, the whole organization can be affected. Right. And so again, that's why when you're making decisions, you just don't make decisions per se just based on what is happening in your unit. You have to consider the entire organization. In a university, you have several colleges. You have the College of Engineers, College of Nursing, College of Dietetics, and so forth and so on. And so we, as a nursing college, our visions, our goals, values, and what have you, has to be congruent with the university. There cannot be conflict if you will. All right. Now, the interdependent nature of the parts of the organization, for example, individuals, you have units, departments, and also the community, suggests that anything that affects the functioning of one part of the organization will affect the other parts, which is what I just said. Now, to be successful today, um, today's healthcare organizations must be able to continually adapt to not only internal changes, but also external changes as well, the geopolitical as far as external changes. Um, so we are affected by both. Your book does provide a case study in 17.1. You may want to take a look at that as well. Now, chaos theory is a more recently developed organizational theory that attempts to account for the complexity and randomness in organizations. All right. When I was working on my DNP, as far as my leadership in development course, we used a textbook. It's probably in my closet in the back of me, but it dealt with chaos theory and how it is applied to these organizations. Because within an organizations, especially today, there is so much in the way of complexities and randomness in these organizations, and you have to have a leader who's able to adapt very quickly to these changing situations or circumstances. Now, despite the implications of the word chaos, don't get so caught up in when you think chaos, it's like, oh my God, everything has just gone to hell, right? The theory actually suggests that a degree of order can still be attained by viewing complicated behaviors and situations as predictable. So you have to look at the predictability of these of behaviors and situations, right? And if you, in other words, when you can predict, you can anticipate, and if you can anticipate, you can put plans, solutions, if you will, in place to ensure that things are done in a way that is appropriate. All right. So just think about it in terms of, this uh, this randomness, this complexity. Um, though there's this chaos, but you have to look for these themes, these patterns, and know what's going to happen before you get to the corner, so to speak. You're anticipating, right? Now, nurse managers may wish for balance and steady work environments, but in reality, that's just not the case. They're dealing with what seems at best a chaotic system. I remember years ago, I would always get upset about it. It looks like every time you turn around, changes were coming, right? And I always thought it was due, and some of it can be, but I always thought it was due to the fact that um, um, you know, that people just didn't know what they were doing, right? But as you evolve and you mature and you become more educated and what have you, basically these our leaders, they were dealing with these complicated, random kind of situations within an organization, and so they have to constantly pivot in order to address these changes. All right, especially when in terms of regulatory, we live in a highly regulatory environment, and you have to be able to pivot. You have to be able to adjust, readjust, and so forth and so on. All right. And so, yeah, we want that linear kind of approach to handling situations, but it's more randomness than anything. All right. Now, chaos theory says that variation is a normal part of managing healthcare systems. All right. Remember, I always talk about trying to minimize as much variation as possible, but hey, there's just some situations, variation is just characteristic of that environment. And so again, you have to be able to pivot and adjust and readjust accordingly. All right. Now, on the basis of chaos theory, now think about this. Um, so you want people to come to work. You know, you don't want them to have sick family members and life emergencies and those nobody's dying and all these things. This is what you would want. That's the linear, right? But in reality, when we think about chaos theory, the nurse manager knows that staff absences can be due to the fact that people do get sick, their children get sick. There's always these family emergencies, death, and otherwise. Uh, and this requires the nurse manager to have backup plans because, see, this chaos, you anticipate that these things may come, but that doesn't stop you as a manager, as a leader, from developing plans to mitigate these changes, this chaos and whatnot. Because remember, what are you doing? You're predicting. All right, you're anticipating that these things can happen. All right. But the nurse manager can have a backup plan in place in the event that staff members call in and are unable to report to their assigned shifts. One of the plans might be an on-call nurse. You don't have to come in as long as everybody comes in for their shift on at that particular given day. Or if the census just is or the hospital census is well, your unit census. You may have a 20-bed unit, and for the last month or so, you only had 10 patients, but now all of a sudden you're slammed with admissions now, and what do? All right, this is that chaos that I'm trying to get over rather to you guys. All right. Um, Now, other examples of variation in healthcare are cultural diversity, a constantly fluctuating patient census. Remember, I just talked about that, and also staffing shortages. Now, until nurses understand that these variations are normal, this is normal, um, predictable state in the organization that should be planned for, right? This variation is normal, but you should be able to plan for them because you know the things that happen within the organizations, and so you anticipate, you plan for. And so they may continue to experience excessive anxiety due to this randomness and chaos with the unplanned, unexpected events that occur daily. And so you have to get a hold of yourself, of course, and just do the best you can as far as anticipating um, and putting those plans in place that can reduce that chaos as much as possible. All right. This is just a critical thinking question. And let's just go to the overview here. All right. Now, classic theories of management suggest that the primary functions of managers are planning, they organize, and they also control. All right. Now, of course, you have and well, let me just say that leaders in nursing management have added two more functions to this list, and now they recognize that five major management functions exist, and this can be seen also in Figure 17.1. These functions are necessary for the management of nursing organizations. Again, there's planning, organizing, and also staffing, but there's also directing and controlling as well. Right, so there are five. Now, these management functions are interrelated. All right, They're not separate, distinct, if you will, but they are interrelated. Different phases of the process occurs at times simultaneously, right? It's like one thing doesn't begin and finish, and then you pick back up on the next thing. Some of these things happen, these situations, they happen simultaneously, and you have to be able to manage, right? The processes are more circular, they're not linear, right? With the manager always working toward improving quality, patient safety, and staff and customer satisfaction. It is a constant job, if you will. All right. And again, just take a look at figure 17.1 on page 306. Now, we're going to just break down the different functions, of course, and planning is the first one. Um, yeah, it is the first one. And so we decide in advance what to do, how, when, and where it is to be done, and who is to do it. All management functions are based on planning. You have to have a plan, right? Um, and there are some important components of planning. You have um, the mission and the philosophy. You have strategic planning, and this is basically long range type of planning where it does extend. You're looking ahead in the future, 3 to 5 years in the future. You also have goals and objectives. Um, Basically state actions necessary to achieve the strategic plan. That's step by step, if you will. And also operational planning. And this encompasses the day-to-day activities of an organization. All right. Now, planning being the first management function, it involves, again, identifying goals and objectives to be achieved, identifying resources that are needed, whether that be people, supplies, or equipment in order to get the job done. Also being able to determine appropriate steps and also to establish a timeline for the action steps and goal achievement. All management functions are based on planning. Without effective planning, the management process is going to fail. It will fail. All right. And so effective planning is going to require, again, the nurse to understand the organization's mission, philosophy, strategic goals, strategic plan, goals, and objectives. And so you must be, even though you may not be running the organization, but these things do impact your individual unit. Now, as far as organizing, organizing is the second management function. At the organizational level, organizing is necessary to achieve, necessary to establish, rather, a formal structure that defines the lines of authority, communication, and also decision making within that organization. Now, the formal organizational structure helps establish the roles and responsibilities of each level of management. Everyone has their job to do. Now, the organizational chart provides a visual picture of the organization, and it also identifies lines of communication and also authority. All right. And you guys should make sure that you become familiar with the organizational chart wherever you are employed. Now, organizing also involves developing policies and procedures to help outline how work will be done and establishing position qualifications and job descriptions to define who will do the work. And so you want to make sure you become familiar with your position, with the policies and procedures. Each unit has one, and so you don't get a whole lot of time to do it. So, you just have to find some downtime, when you have it, and just kind of peruse your policies and procedures. And also, when you guys get a job, anywhere, always ask for your job description. All right, because especially when you're trying to devise a resume, you got that ready document that can help you to, you know, fill in the language that you need to make your resume attractive. Now, at the unit level, nurse managers must determine how to best organize the work activities to meet goals. Now, organizing it involves using resources, again, staff, supplies, and also time, and it has to be done wisely. Assigning duties and responsibilities appropriately. Um, and this, of course, is when a job description would be very helpful. Also, coordinating activities with other departments. Remember, it's not just about you. You have to consider what is going on in other departments and how you can work as a team, so to speak. And also effectively communicating with subordinates and superiors to ensure a smooth workflow because we're all in this together. I said I was going to stop at 16, but these are not as long, and so I may just go to 20 and then come back a little later. Now, staffing is the third management function. Now, the provision of healthcare is labor intensive, right? It's probably the most labor intensive of the job as a manager. Um, and this is with a workforce that is made up of people with a variety of education and skill levels. You have professional nurses, you have physicians, you have pharmacists, social workers, therapists, dietitians. You have LPNs, technicians, as well as assistive personnel. So that's a variety of team members to have to manage. So you can imagine the complexity of just that alone. Now, hiring and managing staff to accomplish the work of the institution are important functions for all levels of managers, even the directors. Now, Marcus and Houston have described steps in the staffing function as follows. Um, Determine the number and the type of staff needed on the basis of goals and budget requirements. Can't forget about the old budget, right? You should recruit, interview, and select, and also assign personnel according to job description as well as performance standards. Also, get new employees off to a good start by offering excellent orientation. The orientation has to be comprehensive, has to be meaningful, all right, and clear. There must be training for new hires as well as socialization programs so you can socialize them into your culture. Also implement an ongoing staff development program to ensure that employees at all levels have the opportunity to not only develop personally, but especially professionally as well, and also to enhance their knowledge and their skill set. And also implement creative and flexible scheduling based on patient care needs, employee needs, and also productivity requirements. You don't want a rigid schedule. Some people, for example, if you're a tech, you might be in nursing school, or maybe you are already a nurse and you're in graduate school, and so or you have family and so forth. And so a flexible creative schedule which is mostly in the hands of staff nurses and not per se a day-to-day operation of the nurse manager. So, and especially your magnet hospitals, they do allow certain ones and certain nurses, team members to devise the schedule. Now, the staffing process most likely will prove to be one of the most time-consuming and challenging functions for the nurse manager. However, it is probably the nurse manager's most important job. All right. Now, little can be accomplished without the right people properly trained to do the work in an environment that promotes collegial, productive relationships amongst the healthcare team. And so you have to make sure you got the right people in place as you staff your units. Now, nursing leaders are highly concerned with recruiting and retaining a talented RN workforce. It can make or break you. Now, factors positively associated with RNs work satisfaction are also presented in box 17.4, so take a look at that. These factors are based on research studies and provide leaders with information about how they can increase nurse satisfaction, reducing nursing turnover, and also improve recruitment and retention efforts. I said to you earlier in our other presentation that to train a new nurse, it costs the organization about $80,000. And so you want to improve satisfaction, you want to reduce turnover, and improve the recruitment of some of the best, right? And also retention efforts. And I would tell you that the local hospitals, they look to organizations, nursing organizations like UNF and JU, for example, or even FSCJ. They looked at these organizations, to be honest, even Chamberlain, they looked to them um, to recruit some of the best um, students to come work at their organizations. I told you that one of the with the progressive care units at the hospital at Baptist downtown, she always pulls my students to the side, and goes through the whole residency program process and gives them her card and all these things. And so she's on top of her job. I'll tell you that now. Now, as far as directing is the fourth element of management function. So after managers have planned what to do, they've organized how to do it, and you staff positions to do the work, they must now direct personnel and activities to accomplish goals. Now, directing involves issuing assignments and instructions that allow staff to clearly understand what is expected. People need to know what are your expectations. In addition to guiding and coaching staff, remember those are the traits of a good leader, to achieve planned goals. Now, directing requires the nurse leader to clearly communicate performance expectations, and I always say over communicate, right? I'm tired of hearing you say that. Well, I'm coming at you again. Over communicate. Create a motivating climate and team spirit. Also model expected behaviors. You be the example, right? As the leader, as the manager, and also facilitate feedback. You want to know what's in their minds because you may have to clarify some things. As far as communicating performance expectations, it is the manager's responsibility to monitor how well staff are performing their jobs. The first step is to ensure that staff clearly understand job expectations. Don't leave it to them to guess. All right. Now, as far as creating a motivating climate, very important. All right. Now, motivation is the inner drive that compels a person to act in a certain way. All right. Now, a great deal of research has been undertaken to better understand human motivation. Most researchers agree that motivation is complex and involves a combination of extrinsic or external rewards such as money, benefits, um, and working conditions. In addition to intrinsic or internal, in other words, needs for recognition. People want to be recognized for what they do, self-esteem, as well as self-actualization. Now, box 17.4 summarizes factors that influence nurses' job satisfaction and dissatisfaction. You should know both so that you can create an environment that promotes more job satisfaction. And this strongly influences motivation in the work setting as well. Then also there's positive encouragement and support from nurse leaders are essential in order to create a motivating work climate. Right, this is the goal. Now, an effective method to demonstrate encouragement and support is a technique that is known as management by walking around, not hiding in the office, but a manager who is walking around. And what this is the nurse manager literally walks around the unit with the primary purpose of interacting, having positive interaction with the staff, not that drill sergeant mode. Now, just as it implies, management by walking around allows the nurse manager to interact with many different staff on a day-to-day basis. All right, it promotes quality patient care, and it also builds positive relationships with not only staff but also patients, families, as well as the interprofessional team. Now, there's also role modeling. Positive role modeling is another effective tool the nurse can use to create a positive team spirit and also promote high quality patient care. Positive role modeling simply just means that the nurse performs the job in a way that he or she demonstrates ideal performances as a professional nurse, with the hope that others will follow the example. Now, several other skills are essential as nurses function in the directing role, and this includes effective communication, again, over communicate, and also conflict management skills. There's also delegation skills one must possess, as well as team building skills. All of these characteristics or attributes are a requisite for a good manager. And then we have controlling, another function, or the fifth function, which is to ensure that employees accomplish goals while maintaining a high quality of performance. Now, controlling requires the leaders to establish performance or outcome standards. You know, it's all about that standard. Determine action plans to improve performance, right? And evaluate employee performance through performance appraisals and feedback. All right, which should be more constructive rather than destructive. Now, as far as establishing performance standards describe a model of excellence for work activities and serve as a basis of comparison between actual and desired work performance. This is what you're doing, but this is what we desire you to do. For example, for performance standards in an ambulatory outpatient clinic might include every patient is informed about all laboratory results within 48 hours, whether they're normal or abnormal. And another one is all diabetic patients must remove their shoes and socks for a complete foot examination each time they come to the clinic. As far as evaluating employee performance, evaluating employee performance occurs through a formal annual evaluation process and through a frequent feedback as well as coaching provided to employees. In other words, you don't want to just drop the bomb on them, at the end of the year, but throughout the year, you're constantly communicating with your staff, and you're coaching them, and you're helping them to rather um, uh, improve daily, so to speak. Now, managers should never wait until the annual performance review to discuss these problems or deficiencies with the staff member. That's something I never did like. It has to be consistent, ongoing feedback. Coaching about job performance is required to clarify expectations and also to improve the work quality of work, and also allow the manager to correct problems before they become serious. Because if you allow it to, go on for the whole year, you don't know what it may lead to. So, doing this thing, on a more or less daily basis is underscored. Now, feedback and coaching can occur in brief, and it doesn't have to be long drawn out, but it can be brief. It can be spontaneous interactions, or in planned sessions with the employee. I like to walking around. Hey, can you make sure you're getting the call lights more timely? You know, can you make sure you come back from your break on time? Those types of things. Take a look also at box 17.5. It presents useful tips for effective coaching. Right now, ongoing documentation about an employee's job performance is also an essential management responsibility. You don't want to try to keep it in your head, but these things should be documented. Now, each healthcare organization has specific policies related to documentation of employee performance and annual performance evaluations. And so you have to become familiar with that. Now, the results of routine performance evaluation should be mutual goal setting, designed to meet the employee's training, their educational and professional development needs. And that's what it should be all about. And so this one is a critical thinking question. We'll go past that one. You can look at that when you get an opportunity. And so the next one is actually patient satisfaction and customer service provider. I'm going to stop right here, take a little break, and then I can come back at some point and start from slide 21. Thank you, everyone, and please take a look at part 2. I'll make sure I provide that for you as well.